Well, good morning. Thanks very much. It's our great pleasure to introduce the strategy very briefly to the room. We launched it last night at Te Papa, which was a great occasion, and we are very, very proud of this document at the Asthma Foundation and very appreciative of all the people that contributed to it. So we don't have a lot of time today, so Kathy and I are going to introduce you to it and the concept of it, and I'd encourage you all to get hold of a copy and read it. As has already been mentioned, it'll be sprinkled throughout the next 2 days, focusing on what we're doing at the Asthma Foundation and what we're all doing here. So earlier this year, the Asthma Foundation released a Burden of Disease report, which was commissioned by us and put together by the University of Otago here at Wellington. Lucy Telfer-Barnard and her colleagues put it together. And I'd encourage you to read that as well. It's available on our website. It's depressing reading. It's very sombre reading, but really important reading. And in some respects, it forms a companion document to the strategy because it tells us what's wrong and what the problem is. And the strategy is hopefully the document that tells us what to do and what needs to happen. And in some respects, the strategy, you could think of it in a lot of different ways, but one of the ways I'd like to think about it is it's pulling together a lot of work that's already going on. There's heaps of people, most of you in this room, doing stuff already. And we want everyone to be pulling in the same direction. And I think of it as a battle plan, because we need to take this fight, and we need to fight for people with respiratory disease. And so that's one of the ways of looking at the strategy, is that it's something to wield as a weapon. And so what we're going to do is, this is what we think of the strategy. It's telling the story of respiratory disease, and it's a sad story, but it's calling everyone to action, from the top to the bottom, from the Minister of Health to community respiratory nurse out in the regions doing his work. All right? And we're going to touch on some of these things again today. So it was a pleasure to follow on from Lance. I'm from Whangarei, from Parua Bay, and some of my stories are going to mirror what Lance has already said. We kind of don't need to answer this question in this room, but for everyone else out there, for planners and funders, we do need to tell them what the problem is. I haven't got many graphs. I've got 3 graphs. This is the first one. This is from a paper that Richard Beasley published in The Lancet in September. The purpose of the paper was to look at prevention of asthma and whether it's possible. And there isn't a lot that we can do at the moment to genuinely prevent asthma. But this message is important, right? Asthma prevalence is going up. And it's going up everywhere. The important thing about this is not which country is which, but almost all of these lines are heading in the wrong direction. In affluent countries like New Zealand, asthma is already high, and it's probably going to get higher. And even in less affluent countries, it's becoming more prevalent. So this problem's going to grow. The top's been cut off there, but this is asthma hospitalisations by ethnic group. Now, the Burden of Disease report is full of graphs like this, and I could have put up another 6. Bronchiectasis looks like this, COPD looks like this. And, this is disgraceful. And that's one of the key themes that came through it, all right? So that's ethnic disparities. And this one happens to be bronchiolitis in infants. But again, if you break it down by quintiles, this is what respiratory disease looks like in New Zealand. And following up from what Lance said just now, in actual numbers, this is around 300 actual admissions to hospital from kids living in, Kandala and Remuera. 3,000 admissions from Mokopuna living in Kaitaia and Porirua. Because the strategy isn't about graphs and data and numbers. It's about people, and the respiratory strategy is for these people. So these are 2 cases of patients that I've seen in my respiratory clinic at Keneperu. Dave's a retired freezing worker originally from Gisborne, and he's got severe COPD. He started smoking when he was 12, and he still smokes 5 smokes a day. And he needs home oxygen, but he can't have it because he's still smoking. And he's tried lots of ways to give up, but he doesn't have a lot of support. He's quite isolated. He reckons he could quit smoking if the price went up. He can just afford it. He can only just afford his prescriptions, but he can still afford smokes. But if it went up, he'd probably stop smoking. So smoking cessation services haven't worked for Dave, and a comprehensive smoking cessation strategy is really important. On the other end of the spectrum, Jasmine's a young girl who goes to Aotea College. Her mum works as a cleaner at Keneperu, and she has bronchiectasis and asthma, both quite severe, and she's been known to the paediatricians for a long time. And she's a really good kid. She plays netball. She takes all of her medications. She does her postural drainage in the morning. But again, Lance and I didn't confer about this. She lives in a house with her mum and 5 siblings. She shares a room with 3 other kids. and it's a Housing New Zealand house and it's not very warm. And so she's doing everything she can for her health, but there's stuff that she can't control. All right, her mum's on minimum wage and they don't have enough money. So, so that's really depressing. But so that if you need any answer, is why we need a concerted strategy, because everyone's working really hard already. But what can we do differently that might make a difference? Well, this is the process that we went through. The expert advisory group was formed a couple of years ago now, but we spent a lot of time working on what the strategy would look like and what it had to have in it. The key moment was bringing Kathy on board, because she really put impetus behind this and did a lot of the grunt work that got this thing together. The two most important things were two key surveys that we did. We surveyed the respiratory community comprehensively very early on to ask them what they thought a respiratory strategy should have, whether they thought it was important or not, and the answer was yes, absolutely, we need one. And they gave us lots of really important stuff to put in it. So we went away and we did a draft, and then we went back to everyone and we said, what do you reckon? And then they all responded again. So it really is a community document, and we really value that because it means that everyone's contributed to it and bought into it. And I don't think there was one single bit of feedback that didn't have some influence on the final document. So we really listened to what people were saying. I think I'll hand over to Kathy now, and she's going to go through the content.
Thanks, Kyle. Kia ora koutou, everyone. I'm going to go really briefly through the 5 areas in the strategy, but Lance has already beautifully, eloquently done that. So I want to get to the bit about implementation and how you can all bring the strategy to life. So the strategy has the 5 high-level goals. They're all interconnected. It's a bit artificial to break them up. They're all interconnected, and each one has the key issues. It discusses what approaches we think would make the most difference to respiratory health, and how can we help the people that are most affected first, because that's going to make the most difference. Te taio, the environment, the conditions of our daily life. How can we improve those to make a big difference to respiratory health? Whānau ora, really about teaching knowledge and skills so that people and their whānau can manage in the best way they can. And it also looks at the roles of schools in supporting our young people. But health literacy is a huge theme right throughout the whole document, and health literacy is everyone's business. It's not the business of just the person with the condition of their whānau. We all have a role there. Who's that superstar? TJ. Te hapore haora, health community. So this is a really big section, and it's about upskilling and supporting our health workers in health literacy education and cultural competence, and providing them and supporting them with clinical guidance and tools so that they can do the best job that they can for our people. Te pūnaha haora, the health system. This is the big complicated bit. What needs to be done at the wider health system level? There is a lot. And the first thing we need to do is to push for respiratory health to become a national health priority. So we need you all to be speaking this wherever you are. It needs to be a health priority. That is the first most important thing for the health system. Rangahau me te aromata tai, research and evaluation. You know, when you do something and you do a project and you end up with more questions than answers, this was like one of those projects. We've got huge gaps in our evidence base. We need to know more about respiratory conditions and about why people suffer so much and about why some people are worse off than others. And we need a lot more concrete evidence about what works so that we can get investment in programs and actions on the ground. And I know that a lot of you in this room know in your work that you do, what actually works. But when it comes to getting funding for programs and getting respiratory health as a priority, we need some concrete data to help with those arguments. This is where I wanted to get to. The strategy, we want to be a practical tool to help you with prioritisation, making decisions, planning and project management, raising awareness, advocacy for respiratory health in your areas, and collaboration, which is another big theme right throughout the whole document. So please read the strategy first and have a think about where you fit in your different roles. And use the content, use the arguments, the logic, the data in there to help guide through some of these really difficult decisions that we have to make when there's competing priorities, there's competing funding. And please use this information also in your project plans, in your business cases. Just take the arguments out of the strategy and develop them how it's meaningful for what you're doing. And you can put in funding applications that should be useful for things like that. When you're working with others and across agencies and with people that are not so familiar with respiratory health and like, why do we have to work together? You know, put the strategy on the table, encourage a shared vision and use that framework so that everyone can see where they fit into the bigger picture of respiratory health. And please remember when you use the document that you have the weight of the respiratory health community behind you because their voice is in this document. It is not something that the Asthma Foundation has sat down and written themselves. So be confident in what's in that document when you are advocating in your own workspaces. So you might be interested in what the Asthma Foundation is going to do to help. Well, among other things, we are strongly advocating for the new national health priority for respiratory health. And I can tell you that our new CE, John Wills, is not shy in this area. He is very strong and firm in advocating at the highest possible levels. So please be assured that we are doing that. And also we are developing a new web portal. So this is going to be a one-stop shop that I hope will be extremely useful for you all in terms of up-to-date data, information, advice and research. And it will also show where the gaps are in those areas too, so that we encourage them to be filled. We'll continue to develop information tools for health literacy and tools for planners and funders as well. And we've got underway with the support of Richard Beasley and the Medical Research Institute. He started developing the guidance for adult asthma management, and following that we will be working on the guidance for children. And that is long overdue. I think Tristram mentioned that last night. Finally, we'll be working with the communities, the agencies, and different countries also involved in research and evaluation to build a new and refreshed program for respiratory health research. We want to champion that going forward. That will be my new job. I'd ask you all to keep in touch with us, please. We want to know what actually would help you in your mahi as you go about your daily work. What would help you to be able to do your job better? And it may be some kind of information tools, or it may be a bit of a summary of the strategy in a particular area, or it may be that you want us to go and advocate to government in a particular way. Please get in touch with us. We want to collaborate. I believe that process is just as important as outcome. So the process of the strategy was a collaborative effort, and obviously implementation has to be as well. we want to work with you, so please keep in touch. And finally, I just wanted to emphasise that, you know, in health, we're all here because we care deeply about people and we want to make a difference. And I believe our brains are a little bit wired in a way as well, that we somehow enjoy the challenge and complexity of the subject matter of health. And we need tools to help us navigate through that complexity. And I would implore you to please use this strategy as one of those tools. Nō reira, tēnā koutou katoa.
Just to finish off, we've touched on this already, but that's just some of the organisations that gave us very, very detailed and good feedback. Those are the members of the EAG that put in a lot of voluntary time towards the process. Kathy's name's not up there, but she was the, I don't know, what would you say, the herder of cats and getting everyone together and getting email responses from people. And as well as all those organisations, there were dozens of individual people in the sector that got back to us and supported us and gave us really excellent feedback, and we put as much of that in as we could. So just to reinforce what Kathy said, that this you need to wave and brandish in front of people and use it because this is essentially agreed to by almost everyone in the respiratory community in New Zealand, and that's one of its strengths. Thank you.
We've got time for just one or two questions, if there are any comments or questions. Nothing at the moment? All right, well, in that case, I'll invite our Chief Executive, John Wills, to thank the speakers. Oh, we got a question? We have got a question? Excellent. Let's just wait for the mic.
Thank you. Hello? Yeah. I was just wondering, you talked about the new portal, and I was just wondering when that was actually going to be available and come online.
Is Tanya here? John can answer.
We're working on it at the moment with an Australian organisation, so hopefully within the next 2 months that's up and running.
Excellent.
Within the next couple of months.
Yeah. And then you'll advertise to everyone that it's wonderful. Thank you.
Thank you.
Thanks, John. Thanks very much. Oh, thank you.
Lance, I'd love to catch up with you later on because we've got something in common. I was expelled from 2 schools.
Doesn't he put that on his CV?
When I was very young. We just want to thank you so much for the dedication and commitment in developing up the strategy. But I just want to assure you on behalf of the board and the team that we're going to action all the recommendations, and I'm going to put my heart and soul into it to ensure you in the next 3 years we make a difference. So thank you so much.
Thank you.